Yeah, I do foam rolling as well, and including my calf. And I agree, it definitely helps to release some of the strain. I didn't know, well, I knew about CPM before my ACL surgery, and I asked my surgeon about it, and he said it's not necessary. Um, After the second surgery, I again suggested it. He said, no, it's not going to help. Um, I changed surgeons. I had a third surgery, and I started CPM the day, like that day, the day of surgery, they had me on CPM. And I think it was the single most important difference. There were a lot of differences in those two surgeries. One was that it was delayed, so my knee was able to calm down before the third surgery. But CPM was absolutely essential to my recovery from the third surgery. Um, I was so obsessive with it. I'm a professor. I actually taught classes with my knee in the CPM machine.
Wow.
So I was kind of lying almost like my leg was lying down with my knee in the CPM machine, and I was sitting up, sort of pretending to be official in front of a group of students. But because of COVID, we were on Zoom, and so I was able to teach the class and be on the CPM machine at the same time. So I would do it for 3 hours. I mean, I had very long CPM sessions. It
Mhm.
was not 15-minute sessions. It was
Mhm.
hour, 2 hours, sometimes 3 hours. And it was extraordinarily important and helpful in, as Gina said, sort of slowly
Mhm.
increasing range of motion. And it,
Mhm.
that's kind of my core takeaway of how to recover is it's so slow. It's like, what used to be glacially slow. Obviously that's
Mhm.
changed with
Mhm.
climate change, but very, very slow
Mhm.
changes.
So I'm curious if anyone feels that CPM has helped extension. It's fairly well known that it helps with flexion and inflammation, but do any of you feel that it's helped your extension as well, or maybe you didn't have a problem with extension?
I think it helped. I mean, I don't have I don't get down to zero all the time. Sometimes I do, sometimes I don't. But I don't think I would have gotten that far without the CPM.
That's
I also
terrific.
used an extension brace at night for about 10 weeks, and so
Hmm.
it's hard to know which was more important. They might
Hmm.
have both been important. I don't really know, but um, I think it helped.
And how long did you use CPM for post-op?
3 months, maybe four
3 months?
months.
Yeah. Yep.
I mean, many months.
Yep.
I don't know exactly, but I think it was at least 3, if not 4 months.
Yep.
I still use the CPM machine now 7 months, 7 months after my patella surgery. So, and it still helps
Yep.
for the
Some
reasons I
people
told, for calming down inflammation, etc.
some people do use it very long term. That's terrific. So, Tom, what was your experience finding a clinician who understood what they were dealing with?
Well, give me a few seconds. So when I had my initial accident in football, I did not know that I developed arthropibrosis. But the surgeons, they were aware very soon. And so just before my reconstruction surgery, I had a mobilization under anesthesia just to improve mobility before the reconstruction surgery.
So, yeah, okay.
But it did not help very much.
Mm.
The doctors and the surgeons, they were, as I said, they were very aware of the condition. But it evolved in such a bad way that the physiotherapists, they struggled to deal with it. So first we tried to improve mobility very slowly, but then soon we tried to push in order to achieve extension. That was the main objective, the main goal. But it only got worse. So when we pushed through my pain, there was no progress. So it only got worse. And
Mhm.
that was a few months after my reconstruction surgery, when we did not know, okay, where do we go from here now? So will it get worse? Will it ever be good? How bad will it get? And we did not know. And that was also mentally, that was kind of a difficult situation. And so I had a team of physiotherapists at the hospital. I still have, and we try to give a lot of feedback. They try to research about the arthrofibrosis condition. I do it myself also. I try to give a lot of feedback, and so we together we looked for an approach how to treat my condition. And yes, that has been going now for almost 2 years. And as I say, there's progress. It's very slow, but there's progress now. And so I feel optimistic.
Fabulous.
Yes.
Gina, I think you've had a few difficulties finding a good clinician to help you.
Yeah,
so
I've yet to
actually, I
find
did not answer the question. So as I said, the physiotherapists, they did not know about arthrofibrosis in the beginning, but as I said, this has been going now for 2 years, and we learned a lot. And we also took advice from a physiotherapist in Switzerland, from the UCAF Center. And also in the telehealth consultations, I'm not alone. The physiotherapists, they assist, and there is a good, there's a good conversation about the knowledge. They try to learn from each other, and that really helps. In my rehab.
That's good to hear.
Yes.
Yeah, Kaylee, my experience has been that's been the most frustrating part of this condition. The pain has been very difficult, but the lack of anyone seeming to understand what was happening, and the lack of support. I feel like there was almost they didn't want to see me. They didn't want to see that I didn't have the usual recovery they expected. I was very active before I had surgery, and to know that it's created a disability for me, they don't want to hear that. Physical therapists in my area know nothing about arthrofibrosis. You can tell they're at a loss. I went to physical therapy for about 4 months with no progress, and in fact worsening because of the extensive, pushing, and there was almost insinuating that I was the one that caused this, that there was a lack of me doing what I should have done. I heard a lot of talk about, you need to try harder than you've ever tried in your life. And honestly, I couldn't have tried any harder. I felt like mentally and physically, I was at the end of my rope. I had done everything I had been advised to do. Nothing was working. It only made things worse. Really, there was support from the IAA as the first support, kind of a lifeline for me. Someone understands what's going on. This is something, it was causing me to doubt myself. I was wondering, why is this happening? Why am I not, having the normal outcomes as other people? Did I do everything I was supposed to do? I was questioning myself. So that's been one of the most frustrating parts of arthrofibrosis, is the lack of knowledge. And almost after doing some research, a couple of orthopedic surgeons that I've spoken to about it, the only treatment that they want to offer me is a manipulation under anesthesia. And they tell me it's a high likelihood that I could have tissue damage, my leg could break, here's all the complications that could happen, but we don't know what else to do, because look at you, your leg is so stiff, you have to do something. So, let us try. And even to the point where they will almost laugh when I tell them about other surgeons in the world that are doing, different treatments to release some of the scar tissue. They've basically just said that's impossible. You can't remove enough scar tissue to make a difference.
Wow.
So it's been really disheartening. I do know that the area that I'm in, the healthcare is not the best. And so I know in the future, if I don't eventually get the progress I'd like to have after, giving time and working the CPM for a while, I know that I'll seek treatment elsewhere, now that I know there are doctors that actually know what this condition is and have some ideas of how to treat it. But yeah, that's been the most frustrating part for me, is it's very isolating.
Wow. Yeah. Thanks for sharing it, Gina.
Sure.
Yeah, I'd like to just, I don't know, share Gina's experience in so many ways. And just for context, I was an extremely serious athlete. I was a college soccer football player. I played semi-professionally. I've gone through dozens of injuries. I've gone through, I don't know, dozens of recoveries from very serious injuries. And the way I was treated when I was experiencing arthrofibrosis was essentially what Gina was saying. People didn't believe that I was doing my rehab. Oh, well, the reason you're doing this is because you're going home and sitting on your butt or something. And I couldn't have been working harder. I mean, I couldn't have been more, judiciously doing everything I was asked to do. And it just got worse and worse. And when I contacted IAA in the summer of 23, I was in pretty desperate situation. My insurance company wouldn't give me recommendations. They had no characterization in their systems of arthrofibrosis. There was no code. There was no doctors associated with arthrofibrosis. When I asked for a list of any doctors in the region who had any expertise, they gave me examples of hand doctors and podiatrists. They had no idea. And while my initial surgeon knew what arthrofibrosis was, it wasn't a question of have you heard of it? It was a question of, do you know how to treat it? And it was extraordinarily difficult to find a surgeon and a physical therapy team who actually understood what was happening. And I mean, I live in Minnesota, and we have the Mayo Clinic. We have some of the world's renowned surgeons. We have enormous medical expertise. And the understanding of arthrofibrosis is so thin, and so there's so much doubt of what patients like me were saying, and my doctor just didn't believe that there was some arthrofibrotic explanation for what I was experiencing. It was me, which put me in a really deep hole emotionally. Like, how am I ever going to get out of this? And speaking to the IAA through email, and then to a physical therapist in Switzerland, probably the same person that Tom spoke to, was the first time that I felt like I was understood. Like someone actually knows what I'm talking about, and even more importantly, knows what to do next. Like, I had no idea. I had no experience. And it's just a very difficult place to be. And I really condemn the medical industry for not taking it seriously, and not. I think Gina's point about, like, the surgeons don't want to admit that this is a result of surgery. It's not only a result of surgery, but I mean, if I had known this was a possible outcome of surgery, I mean, I may have tried to rehab my ACL without surgery. I mean, this has been so devastating in so many ways. So.
Yeah, I can understand. I think a lot of people will relate to what you're all saying. But a lot of medical gaslighting and ignorance, unfortunately, and I hope that we can change that together. What was your experience, Masood?
Oh, I also had a very difficult time with several orthopedic surgeons and also physiotherapists. And as I said, I was undiagnosed till like my last surgery, which was a patellar tendon lengthening. And during the procedure, the orthopedic surgeons removed some scar tissue. I mean, a lot of scar tissues, which returned afterwards. And after the surgery, he was telling me, yeah, maybe it's not arthrofibrosis, but I had a very excessive scar tissues inside my knee, and it was very difficult. And as Gina said, I was also at the end of the road. I went to the psychiatrist even, and like he diagnosed me with some like PTAD, like post-traumatic depression disorder. and he helped me a lot actually to go through the way, even more than the orthopedic surgeon. And yeah, I think, as Gina said, it's like kind of a lack of information and also lack of education of patients about the risks of the surgery and so on. And even I'm in Switzerland, and we have a like quite high level of standards. What's like the medicine and orthopedic and all this stuff. But yeah, it was not. I mean, with arthrofibrosis, most of doctors were not really familiar. I would, yeah, unfortunately, yeah.
So, can you kind of tell me what effect arthrofibrosis has had on your life, the impact of it? If you can just summarize that. Masood, has it affected every aspect of your life, do you think?
Yeah, I mean, actually every aspect almost, but also like I can like Matthew, I can live my life, I can do almost everything, but it's everything is limited, I cannot do much. I should always listen to my knee, and like running or high impact sports are almost impossible. And I can go walk, and yeah, I always have to listen to my knee. And I hope that, actually my only hope is that the research is in maybe in few years so far that like a combination of surgery and the right medication can fix the problem. Yeah. This is my, I mean, yeah, I would say just we should stay strong and don't lose the hope. And yeah.
Thank you.
Yeah.
You're welcome. So we're getting towards wrapping up now. Can you, Tom, explain or tell me what you think was the most helpful or the least helpful approach in therapy for you?
So the least helpful and the most helpful treatment in my rehab, do you think? Okay, so
you can pick one if you wish.
Yes, I try to find the right answer.
Best or worst?
Well, the most important treatment or advice that I would give to myself is not to be afraid to look for help or to have a lot of different opinions, and not only listen to one person, but try to have a lot of different opinions from everyone who can have a relevant opinion in arthrofibrosis. And then also, if only if you have a lot of different opinions and you do your own research, because a lot of the knowledge that I acquired was because of my own research. I tried to read a lot of medical papers on arthrofibrosis. So I would say that is the most helpful advice, so that I could listen to myself, because I understand my pathology, and that is very, very important. That you understand your pathology so that you can react to whatever is going wrong. Because otherwise, if you don't understand your pathology, it is a great source of mental illness or depression. And that I would say this was the most important advice that I try to give someone. Try to understand your pathology so that you can react and you can live with it. The least helpful approach, I would say, is not listen to yourself. So if you don't feel like you have to do something, or don't put pressure on yourself, because other people always they They try to they want something from you. They don't really understand your condition. They see you walking, but they think you're okay, but actually you're not. So just listen to yourself. So don't try to have advice from people who don't understand your condition. That is the least helpful advice. Yes.
Thank you. How about you, Gina?
I guess I want to echo a little bit what a lot of people have said. In addition to the CPM machine, the platform, and elevation, mental health counseling has been so important for me. And I've also noticed, interestingly, when I become really stressed, I can feel that fibrotic tissue tightening. When I can relax, I can feel it relaxing some. So it feels like there's even a connection with mental health with that tissue, which is interesting to me. I've had a lot of help. I think I've had a lot of support from family members, friends. My employer has been very supportive and allows me to work remotely, which has greatly helped me. Just being consistent with my care, what's right for me. As Tom said, I listened to my body. When I was scheduled for that manipulation under anesthesia, something in me said, this is not right. Don't do this. This is the only thing someone's offering you, but it's still not right for you. And I canceled it. And I was scared that I canceled it because it was the only plan that I had, but I was able to find other resources through the IAA and things that are helping me. So I just try to maintain that schedule. It's a rigid schedule. I plan everything about my knee and when to take care of it. Definitely trying to eat a healthy, non-inflammatory diet, lots of water, making sure I get adequate sleep. And then just not pushing myself, not thinking of the things that I did before and saying I should be able to do this. This is what I'm able to do today, or I'm sorry I can't do that, but I could do this. Trying to find other options and ways to do things that don't inflame my knee more.
Yeah, thank you. That's great. Matthew, what do you think?
Yeah, I'm going to echo a lot of things that have already been said. I think of my knee as a inflammation waiting to happen, and my job is to do my best to not let it get inflamed. And I think it's almost like the difference between Aikido and judo, or like a martial art that's sort of direct and forceful. It just doesn't work. Trying to get my knee in a position it doesn't want to go in, or to do an exercise it doesn't want to do, or to get more extension by forcing extension, or to get more flexion by force doesn't work. I think fooling my knee is what works. Tricking it into thinking it's not doing anymore, and so it's calm, and just doing that tiny bit more. Like I can fool my knee into improving over time, but I really have to be thoughtful about it. And I learned, it took me a long time to learn this, but I learned to tell my physical therapist no. And I cannot put my knee in that position, because in the past, when I always thought of the physical therapist as that sort of the cheerleader, the person to push you to do things you didn't think you could do, and then you do it, and yay, you've done it. But I've learned that physical therapists don't know. And when they push you into a place where your knee gets inflamed, or pushed me into a place where my knee gets inflamed, things got worse. And so I feel like I had to teach my physical therapist to think about this recovery in the longest possible terms. Like, I'm not going to be here for 2 months and then you're going to say goodbye and, success. I mean, I've been going to physical therapy for over 2 years. After the third surgery, plus physical therapy, a year before that. And they're kind of tired of seeing me, but I also have kind of, I think, shifted their thinking, at least in terms of slow recovery, that it can work. And, it's really trying to be patient. I mean, I think the advice that I got in the summer of 2023, which is, just be patient. And not work harder than you've ever worked before, like someone told Gina, but be more patient than you've ever been before.
Yes.
And it is like kind of like raising a child. I have 2 sons who are adults now, and they did a lot of dumb things for a long time. And You have to be really patient as a parent, and I feel like as a parent of an arthrofibrotic knee, I have to be really patient with it, and I have to treat it with like the softest kid gloves I've ever had before, and it slowly improves, but it's really slow.
How about you, Masood? What do you think are the best and the worst things for your knee?
Yeah, actually, the best thing for me was to accept the fact that treatment options are limited to fix the problem, and it's something that I couldn't I didn't decide. I couldn't do anything about it. It was not my fault that I developed arthrofibrosis. And sometimes I say to myself that what would be the next? I have a functioning leg, and maybe losing that leg is much worse. And the leg is still working, and I can do my daily life. And the acceptance was really was really helping me. Yeah, I think that was like the last stage. Yeah, for me.
I think you've all had some really excellent tips, good takeaways. So if I could summarize, I think we have understanding your condition so that you know where you have a solid base to work from. We have continuous passive motion and whole body vibration and stress reduction. We have acceptance and moving forward and listening to your knee and speaking up with physiotherapists and helping to educate physiotherapists, I guess, as approaches that have all helped you. So I think we've had a really interesting discussion, and I think there's been a lot of important topics that we've covered here that I'm sure will be of great interest to the wider world. And thank you for sharing your stories. Yeah.
Could I add something to the aspect of patience and moving forward that Matthew and you described? So because it is also to all the other arthrofibrosis patients who are listening to us, hopefully, it is very difficult to be patient because you don't know how long your condition will evolve, how it will evolve. Is it going to get worse? Is it going to get better? You don't know. And so it is very difficult to be patient. And what helped me a lot is that I write diary about how I feel. So even if I feel good or if I feel bad, I try to write it down. And then over months, you see, when you read back what you wrote a few months ago, you realize that there are some feelings that you had back then, but maybe you don't have them now anymore. And you see how you have milestones. For example, now 1 month ago, I started to bike on the road. That was a huge milestone for me. And when you see these milestones, or you see how you feel, and you can relate to how you felt back 1 year ago, for example, and you don't have these feelings anymore. So you can build this willing of patience, and you build your self-hope, and that's the most important thing I think that one can have in an arthrofibrosis condition. So it's to have hope. So diary in this way helps a lot.
Yep. Patience, don't rush things. Yep. And finding the expertise to help. Yeah, terrific. Well, they're all very important stories, and I'm sure that people will learn a lot from listening to you. Thank you. And for those listening, if you want to know more about the IAA and arthrofibrosis, please see the link to our website below. And please share your stories on social media so that we can all learn more about this very complex condition. Thank you.
Thank you for
Thank
organizing.
you.
Thank you. Mhm.